And joining us now over the phone is Dr. Amani Abu Zaid, the professor at the Faculty of Medicine, Cairo University. Dr. Abu Zaid, can you hear me?
Yes, I can hear you. Good night or good afternoon.
Good evening, Dr. Amani. First off, Doctor, now how do you view the inauguration today by the President with the attendance of a number of ministers, on top of which is the Minister of Health, Dr. Helal, of these medical complexes in Ismailia, Alexandria, Kafr Sheikh and Upper Egypt? How do you view such an inauguration and efforts exerted by the government in the health sector?
I think this is a very important step towards improving the health sector in Egypt, and I think the president is doing a great effort, and he is sending a message of how important is the health sector for all the Egyptians, and this is, I think, the beginning of starting the health insurance for all the Egyptians. So I think this is an important beginning step for this big project.
Dr. Abu Zaid, now how difficult is it? I mean, we are trying, the health ministry is trying to boost the number of citizens involved within the health insurance system from 58% to 100%. That's over 100 million citizens, Egyptian citizens. How difficult is it to include all these millions of people within the insurance system?
It's not gonna be easy. It's not gonna be easy, and it needs cooperation between, I think, the Ministry of Health, the private sector, the insurance companies, the governmental, the private companies where we work on, to all share in this big project. It will not be easy, but I think it is essential to start it and to try to make it applied. Of course, at the beginning, there will be things, a little problems we need to face when we're going to start it really on the ground. But with time, I think we're going to make it.
We started off with Ismailia, Kafr Sheikh, Alexandria, and Upper Egypt. Now, how long do you think it would take to cover all the remaining governorates in Egypt, for all these medical centers to have efficient and inclusive medical centers and medical complexes all over the country?
Well, at the beginning of the project, I think the government announced that within 10 years, starting from 2 years ago, that all the Egyptians will be under coverage of this health insurance system. And then they again said 10 years, but we don't know if really it will happen within 10 years. The president said he wanted even faster than this, that all the Egyptians. But as I said, I think we need to we need to see what will happen in Ismailia, Kafr Sheikh, Upper Egypt, in Port Said, and solving if any problems there. And then Cairo will be the last government to apply this health insurance system.
Dr. Abu Zaid, now with the establishment of these medical complexes and trying to relaunch the early detection of virus C, now what about the process of reviewing all these complexes and evaluating the performances? Does that also prove to be a long and difficult task to actually make sure that all these complexes are operating in a very efficient way?
Yeah, I think this is the key. For this system to be successful, we need this is quality control and surveillance and trying to see how the system works and to supervise the people working at this system. I think this is the key to make it successful. You know, the start of being having an ID electronically and everything comes electronically. I think this also will help in success of this system. So it needs a lot of cooperation, and as you said, this is an important key point, surveillance. How the system is going, does the people work in the system, from the administrative work, from the medical work, and from the people who are they are on the same track or not.
Yes. Dr. Amani Abu Zaid, the professor at the Faculty of Medicine, Cairo University, thank you very much for joining us. And ladies and gentlemen, now let's check out this report regarding President Abdel Fattah al-Sisi earlier today inaugurating national projects in the health sector and mandating 10 years, a 10-year deadline instead of 15 to complete the health insurance system that would include 100% of the Egyptian population. Let's check out this report and we'll be right back.
President Abdel Fattah al-Sisi inaugurated on Tuesday a number of projects in the health sector via video conference, including the comprehensive medical complex in Ismailia and medical centers in Alexandria, Kafr al-Sheikh and Upper Egypt. Prime Minister Dr. Mustafa Madbouli and Minister of Health Helal attended the ceremony. Addressing the event, President al-Sisi said, "All workers in the health sector, whether martyrs or still doing their jobs, are highly appreciated." The head of state said initiatives in the health sector had been launched ahead of the coronavirus crisis, thanking the sector for the management of the pandemic. The president said there is a medical database for around 70 million citizens. He added there is readiness to relaunch the initiative of the early detection of virus C. President al-Sisi also said there is keenness to finalize the comprehensive health insurance system within 10 years instead of 15. He noted the health initiatives are aimed at alleviating the burden on the health sector until the health insurance project is finalized, as well as creating a social culture heeding the importance of early detection of illness. The president said opposition is accepted, but within a framework of understanding the circumstances. He added that efforts are being exerted extensively to deal with children malnutrition. The president said projects to develop the countryside and line canals and the sewage systems will continue to decrease diseases, stressing that developing the livelihoods is the main role of the state and its bodies. Meanwhile, President al-Sisi called on citizens to positively contribute to dealing with the overpopulation crisis. In this respect, he affirmed that the situation in the country would not improve until population growth rates suit potentials. President al-Sisi stressed no country would be able to provide real job opportunities for citizens under overpopulation rates. The president noted that the decrease in population growth in Egypt has not reached rates seen in other countries.
Welcome back, ladies and gentlemen, and we're joined here tonight in the studio by Dr. Ibrahim Helal, the electrical consultant of a number of healthcare projects, including the Ismailia Medical Complex. Dr. Helal, thank you very much for joining us.
Thank you.
Dr. Helal, first of all, the President today inaugurated a number of medical complexes, mainly the Ismailia Medical Complex, also another one in Alexandria, Kafr al-Sheikh and Upper Egypt. Now, what should these complexes add to the health sector and the protection and taking care of the Egyptian citizen within these governorates to start with?
Actually, it's noticeable for everyone today, the significant steps that were taken for the past few years in developing the healthcare standard, and this is, an important, important word I would like to say, that we are raising the standard of the service of the healthcare. In Ismailia complex, for example, you can see this huge complex with about a total of 400 beds in, dispatched between, patient bed, surgery, ICU, intensive care, and so with, the highest standard that we applied in designing this project for serving the medical services for the patients. Like, in the surgery rooms, for example, you can see, the level of, of standard of access control, of high level of purification, and all considerations that were taken. It's not just, supplying the service, it's supplying the high standard service of medical to the Egyptian citizen.
Yes. Well, Doctor, a few years ago, everyone has been calling on the government and the presidency to really take care of two main sectors, one of which was the health sector along with the educational sector. And the president has shown great efforts and a lot of appreciation as well to the healthcare workers, especially during the coronavirus pandemic. Even last week, the government, as a gesture, issued 15 million coins in appreciation to the healthcare workers. You're a councillor to the Ministry of Health. Do the workers feel that appreciation by the government and the presidency to their efforts and their sacrifices during the past year or so?
Certainly. And I note that even in the enthusiasm for the workers and physicians and doctors in all the healthcare facilities I was involved in. And I will give you an example. For example, in Ain Shams University, we have established a field hospital in just 30 days with a full enthusiasm, just to serve the corona service, for the past year almost. I mean, this kind of fast and enthusiastic steps will never be taken unless there is a strategic look from the government and of course cooperation from all the workers and the consultants and the contractors involved in the process. So it's really a fact that you can stress on that the mutual cooperation and appreciation and enthusiasm for the whole people involved in this process is quite clear, and the results are notable to everyone.
Yes. Doctor, now the president said that the database now for the Egyptian citizen actually includes about 70 million citizens. That's about 2/3 of the Egyptian population. How does that help, or how is this helping the medical services being provided to the Egyptian population, having 70 million citizens included in the database of the government?
Yeah, it's statistics and the database is a starting point to supply any service, for whatever, for electricity, for example, to the participants in the electricity service, for the health care. So this is the best way to start with, is to have a reliable and data that you can trust on and you can base your progress on in order to serve. For example, it's not only just to focus on the big complexes like that we have seen in Ismailia or Alexandria or so. So there are so many activities that can be served with lower level of services, like, for example, a flu or a cold, a case or something like that. So you can find so many units, which we call health care units, in villages and small, areas that can serve the whole people. And then we, the severe cases can be transferred to higher level of service in central hospitals or complexes like the one we are talking. So all this process need a realistic and reliable database that you can count on to serve the people and to know who can go where for that.
Doctor, when when establishing these medical complexes in these different governorates, Ismailia, Alexandria, Kafr Sheikh, and Upper Egypt, now, during the establishment and the design of these complexes, what seemed to be the biggest emphasis on, the biggest divisions, the biggest departments? Was it any heart diseases, chronic diseases? Are we talking about cancer patients, children medicine? What sort of focus or attention got the biggest part of the cake in actually designing these complexes?
Well, the point is the services which are available, and I'm talking now as an engineer. Before, I'm not a doctor, I'm talking as an engineer. When you are constructing a project from scratch, it's quite easy. But when you go for developing an existing building or an existing hospital, it's quite difficult task. The medical plan is to emphasize some activities or some medical activities commensurating to the area which is served by the hospital that we have. For example, you can find, for Abu Khalifa hospital, which is in Ismailia. At the beginning, actually, this hospital was established as an emergency hospital, simply because it's by the highway, and on the highway of Ismailia, Port Said, you can find so many, unpleasant accidents or so. So you can find, reachable to you the nearest hospital for. However, with the pandemic of, coronavirus, it turned to be an isolating hospital at the moment, temporarily because of these conditions. For complex like Ismailia, for example, you can find, a complete department for heart surgery and, dialysis for, kidney problems patients. You can find, incubators for, infants who are, premature, born. So, I mean, when the complex is big like one in Ismailia, so you can find so many services highly served and stressed on that. But if you go, for example, like a healthcare unit, so it's, small service that helps, provide some temporary cases, like, as I told you, cold, the flu, or something like that. So it depends on the area what you are serving. It depends on the magnitude of the projects that you are establishing.
Yes. Well, sir, a while ago, Egypt has undertaken the initiative of the early detection of hepatitis C, and the president said that there is readiness to relaunch this initiative. How successful was it the first time around, the early detections of virus C? And do you think that now we can learn from the first time around when the initiative was launched? In relaunching it, is there a different way of making it covering more of the governorates in Egypt?
Absolutely. In fact, you can compare this with numbers. We used to spend more than 60 billion Egyptian pound for curing the C virus. Now you are spending about 5.5 or so billion, because actually we have taken an action for early detection and giving the medicine and doing some effort in that. So the number is significantly reduced, and of course this because of the initiative of the virus C hepatitis curing.
Yes. Well, do you feel that, because the president said that actually because of that first initiative, Egypt was better prepared to deal with the coronavirus pandemic. How is that so? Were they related? Is it about getting enough information about the Egyptian citizens within their database to be able to have some sort of an idea or an estimation of how the coronavirus pandemic will move around and will deal with the Egyptian citizen?
Yeah, of course. Everything goes with a learning curve. And because of this experience, you know that we were one of the, high street countries in, virus C patients.
Yes.
And this experience actually was gained during the initiative of, high virus C, initiative from the president and from the government. And of course, this was quite useful for us in dealing with the coronavirus. And you cannot see even the numbers. As a matter of fact, I was, talking to a few directors of hospitals. Some of them are governmental, and some of them are specialized or, private hospitals. And I was really happy to hear from them that the number in the ICU, the intensive care units, is reducing significantly in January compared to December. Because this, wave of corona, you can call it the wave of oxygen. And, we had, run during the month of December in some locations with a shortage of oxygen. I think this problem was dealt with spontaneously, and it was successfully actually treated at the moment. And this was impacted and realized in January that we have better situation now in such a way that I heard from these two of them, two different, one in the government, one in governmental hospital, and one in private hospital, that the ICU units are now significantly reduced, and they have beds at least that anyone can go for.
Yes. Well, speaking of hospitals, Doctor, a lot of people were talking about the big gap between the governmental hospitals and the private hospitals, and the government has done a lot of effort to really alleviate and have a better quality of governmental hospitals. How far do you think this gap has been reduced between the governmental hospitals and the private hospitals as well?
Well, it's significantly diminished. And I cannot speak, because actually I was involved in the past few years in so many construction and designing for electrical systems in hospitals, both private and governmental. As a matter of fact, I'm very pleased to see surgery rooms in Demirdash Hospital, for example, that you can compare to Cleveland or any hospital in England, in US, in Europe, wherever you can compare, you can tell. Because actually the surgery room, and it's not one room or two rooms, it's almost 20 surgery rooms, was done by capsule system. And you can see everything like screen that you are in now, and the doctors need nothing to go and to check here and there. Everything is on the screen and with the highest standard level that you can see. And I am pleased to say that actually, and the effort of Ain Shams University was done, and I can notice that also in other governmental hospitals. So I can confirm now that the governmental hospitals is rising high, in this direction to be comparable to the private hospitals. Added to that as well, that the cost, we are going to the governmental hospital was uncomparable cost to that one in the private hospitals.
Yes.
Everyone heard about how much it cost for one night in ICU in private hospital for the past pandemic circumstances. But you can go and take these services almost free in the governmental hospital compared to 30,000 or 40,000, sometimes talk about 60 and 70,000 per night.
Yes.
So I'm very pleased to say that, and I have noticed that with my eyes in so many governmental hospitals. And I wish to see the same in education.
Yes, for sure. Well, Doctor, speaking about actually how much it would cost to go to governmental hospitals compared to the private hospitals. Now, every Egyptian citizen has been really hoping for a good, efficient, proper insurance system that would cover everybody. And the President reiterated in the inauguration event today that he wants the insurance system to be finalized within 10 years instead of the initial 15 years. We understand that it started off in the Bursaid governorate not so long ago, and now there is a plan to include all the governorates in Egypt, to include 100% of the Egyptian population. It seems that it's a big task to achieve in 10 years, only 10 years. And as you've mentioned, it would be financially costly as well. What do you feel are the main challenges facing the government and the Ministry of Health to finalize the health insurance system all over the country for over 100 million Egyptian citizens?
Yeah. We know that the main challenge is the resources. As you know, nobody can deny that. You know that we need resources. But beside that, because actually it's not a unique solution that you can go with it, the culture. We have a culture that if you have a very little pain, you go direct, to the highest level of services that you imagine, especially when it's offered for free for you, or covered under medical insurance. So this is part of the culture need to be changed. I remember when I was studying my PhD in Canada, to see a heart, doctor specialized. I waited for about 2 months to see that one. I was just dealing with the general practitioner that or the family doctor who can say the family doctor. So, and the family doctor checked the case and see that I can stay 2 months before seeing because actually he's quite busy and the queue line for him is so long. So I have to take my turn in that. And without damage, because actually the general practitioner had the judgment that the case can stand to that. So the culture is part of that. So we have to know where and when to go, not just exploiting the coverage of the insurance and go for the highest service and give a burden and more burden on the doctors and the facilities that we have in that. So this is one of the challenges that we are facing. It's not only the resources, it's also the culture need to be changed for that.
Yes. Well, talking about resources, actually the health sector needs about £54.5 billion for health needs. Now, it's a lot of money. How can the government and the Ministry of Health obtain such big amount of money to have sufficient resources for the health needs provided for all citizens?
First of all, we have to say that not all countries are providing full coverage medical insurance to all their citizens, even in the United States. There are some people who are not enjoying this or understanding this. So I mean that it's not. I cannot answer the question how to get the money for that. But what I see is the priority that the government goes with is good priority, and going in good step and the realistic step as well. And we need also as population to help in that, by stressing the point I was talking about, which is the culture of the people. Because we see in the hospitals how the people are putting stress and pressure for the facilities, even without real need to that. For just a small thing they can go.
Yes. Well, ladies and gentlemen, a number of ministers were addressing the inaugural event today, the inauguration of the National Health Care Projects. Let's check out this report and we'll be right back.
In her address before the inaugural ceremony of the project, Minister of Health Helal said only 58% of citizens were included in the health insurance in the past, while the new system targets 100% of the population. Minister Zaid said that her ministry has been working on 9 axes in the new health insurance system, touching on steps taken to deal with the COVID-19 crisis. Zaid expressed her appreciation to medical staff, the martyrs amid coronavirus crisis. For her part, the Minister of Planning, Helal, said the most important achievements are decreasing unemployment and the virus infection. According to the minister, the state has embarked on a number of schemes, most notably the development of the Egyptian family. She reviewed the impact of the increase in population growth rates on a number of fields. In her address before the inauguration event, Minister of Social Solidarity, Niveen Al-Qabbaj, said the state is working on reducing poverty. The minister noted that there is a component in the government program dubbed Building the Citizen. She said cooperating with different ministries, NGOs, to provide medical care, finances and education for the most needy brackets of society. Qabbaj said that the most poor governorates are the highest in smoking and drug addiction rates. She said her ministry is working on alleviating the youth awareness against dangers of drug addiction.
Welcome back, ladies and gentlemen, continuing our discussion with Dr. Helal. Doctor, now establishing these medical complexes in these governorates, you're the electrical consultant for the Ministry of Health in establishing these healthcare projects. Now, what would you say were the main challenges in actually establishing such huge and inclusive complexes?
As I mentioned before, the main challenge is when you are developing an existing building, it's quite complicated task that we can do, rather than if you are starting from scratch to build a building.
So it's harder?
It's harder, of course, because actually you are modifying an existing building, and you need to use the resources which are available and not to get rid of the building or of the facility that you have. So this is one of the main challenges that we really face in that. From the electrical point of view, of course, the systems, because actually you can find so many systems that you need to put nurse call system, you can put data system because of the database that you deal, health management system, that when the patient goes and do some, X-ray or so you don't have to take everything in hand, and the doctor can check by the computer and open the page and find all the data are available, the lab results and so on, so on. So these systems now and the high technology is being implemented everywhere, and of course, sometimes you face some delay because most of this technology is imported from abroad. So you have to wait for a while until you receive these systems and to install them. So it may take a bit time. Although we do all the effort, of course, to magnifying the participation of the local industry in that, but still some technologies are beyond to be reached locally.
Well, do we also focus on the training and the preparation of the healthcare workers to be operating and working within these complexes with the new systems that you've managed? Are we exerting efforts to train and qualify the healthcare workers to have proper cadres operating on such advanced systems?
You actually have touched a point, because beside giving an attention and giving an eye to the construction and establishing this high standard equipment and facilities, we have also to have a look to the human resources.
Yes.
And I think this point is very important, because actually without having this trained and well-paid human resources to guard and to operate this system, I think we will be in a real trouble. We have to take care of that, and we have to pay more and more attention to develop our human resources to be paid decently and well, being, because actually without doing this parallel to the construction you are doing, we will have a real problem.
Yes. Dr. Helal, now the Ministry of Health has undertaken many initiatives. We spoke about the early detection of hepatitis C, but there's also the Ending the Waiting List initiative, which needs about £4 billion. Also curing chronic diseases, also another one for women, the Supporting Women's Health, that actually served more than 12 million women. Now, all these initiatives that have been undertaken and launched by the Ministry of Health with Dr. Helal, how far do you think it took the health sector from one point to another? Are these considered small steps, or are they giant leaps in the health sector and covering the Egyptian, the health of the Egyptian citizen?
We have to look at the heritage, because actually we are moving from a very poor system in healthcare. Everybody can see before, look back 10 years back or so.
Yes.
And go to the governmental hospital now. Ismailia is a governmental hospital, Port Said is a governmental hospital, Port Fouad is a governmental hospital. Go and see. It's really completely different. And these initiatives, we have, to be taken step by step. And we cannot wait, or we cannot expect shortly to have, a complete improvement for everything. But the steps taken, is fruitful, and we can see, down the road, the results are coming. So many initiatives for the women, as you mentioned, for even, the mental diseases.
Yes,
also, we are also involved in that. And we are doing at the moment a complete database, joining all the 27 governorates on one center in here, and to check, all the patient data and circumstances, and so many initiatives. We are moving in parallel in so many directions, not just focusing on one point.
Yes. Well, as you've mentioned, we're working on many initiatives simultaneously, but also not just Egypt, but the whole world is going through a coronavirus pandemic. Now, how is the government and how is the Ministry of Health balancing its efforts in trying to combat the coronavirus pandemic and dealing with the number of patients and fatalities, unfortunately, that take place every day because of the COVID-19 pandemic, and at the same time focusing on the initiatives talking about hepatitis C, women's health, chronic diseases, child malnutrition, mental illness? How is the government and the Ministry of Health balancing its efforts simultaneously among all these different initiatives and the pandemic?
As a matter of fact, I cannot say how, but I can see the results. And I can interpret why the results are promising. For example, we have passed through the first wave of pandemic, and we started the second wave, and we are in almost, by ending this second wave as well. So you can tell, have you ever, found a trouble to find the mask or the sterilizer or all this kind of stuff? You can't find it in the street. Although we have heard about some countries, hijacking some, airplanes at the beginning of the pandemic. So it's a collective effort. It's not just a Ministry of Health or Healthcare. It's a collective effort, and we can say that the military section is doing, a tremendous effort in that direction, and helped a lot, actually, to survive this kind of pandemic.
Yes. Well, if we're talking about the pandemic as well, all the countries around the world now, they're talking about the vaccines, the vaccinations, the availability of different kinds and nationalities of vaccines. How is Egypt doing on that front, getting enough doses of the vaccine, any vaccine, coming to the country to start? We already started the vaccination process. How are we planning to cover the vaccination of the whole Egyptian society?
I have a personal opinion in that. It's just a personal opinion. The vaccine is coming in rush, and nobody can judge, even the doctors themselves.
Yes.
How successful it would be. Until this moment, it's suspicious. Egypt is taking actions and is saving the vaccines, as you see, for the medical staff everywhere. But again, every day you are hearing about different type of vaccine, and we are even hearing about some unpleasant actions for some people who took the vaccines.
Yes.
I mean, until this moment, nobody can confirm that positively that the vaccine is successful to cure or to protect from the pandemic. But if we look to the results, until now we didn't receive the vaccine, we didn't take the vaccine. Yet we are one of the best countries at the moment in the, and the results of facing the pandemic. I'm not talking about the formal statistics that the people may sometimes suspicious about it.
Yes.
But I'm talking about how can I feel myself. You can feel in your relatives, your neighbors, your friends. And as I mentioned to you, that the hospitals I visit and I deal with, I found there is a significant improvement in January compared to December regarding the ICU. So the vaccine issue still, for example, the vaccine of Pfizer, the US vaccine, it's a kind of creating or simulating the virus in the body. It's not the regular vaccine, theory that we know about, like the Chinese one. The Chinese one is injecting by a weak or a dead, virus in order to stimulate the body to create the antibodies.
Yes.
But the case of Pfizer, they are not injecting by the virus itself, dead or weak, but just they simulate to the body as if there is a virus.
Yes.
I mean, for me, it means like you are turning the body like a machine. It's a part of the reverse intelligence that we are talking about. We turn the machine like a human being. Now we are going to turn the human being like a machine. So, I mean, it's still an issue for me personally. It's just a personal opinion. It's a complex issue that we can, it's early to judge or to assess the value and the effectiveness of the vaccine.
Dr. Helal, we're running out of time, but I want to ask you one last question. You've mentioned that the Egyptian citizen needs to have a medical culture that would enable him to operate and actually make use of the insurance system. How can we actually work on developing this medical culture, this health insurance culture within the Egyptian citizen?
A campaign, I mean the campaign that, raise awareness for the people, parallel to the construction and to establishment of the system. So you can do, you have the media system, you have the, social, communication systems like Facebook, like whatever, WhatsApp, and so. So the organized and effective campaigns is the only way that you can do. Like, for example, the birth control, you do campaigns for the birth control. And now, the culture is changed. Before, our fathers and, grandfathers used to have 6, 7, 8 children. Now we are taking maximum of 2 or 3, okay? So, I mean, the campaigns, organized and effective campaigns can help in that, changing the culture.
Yes. Well, and gentlemen, as Dr. Helal mentioned, there is still a lot of work that needs to be done, be it by the Health Ministry or the Egyptian citizen, to help boost the immunity and the healthcare projects within the country. And we've seen the inauguration today of many medical complexes, national medical complexes in Ismailia, Alexandria, Kafr Sheikh, and Upper Egypt as well. Hopefully, the insurance system will be finalized within 10 years, according to the president, instead of 15. A lot of efforts being exerted in the healthcare file. Unfortunately, that's all the time we have for this edition of the Daily Debate. But before we go, I'd like to thank my very distinguished Ibrahim, the electrical consultant, a number of health projects, including the Ismailia Medical Complex. Dr. Helal, was a pleasure having you.
My pleasure.
Thank you very much, sir. Ladies and gentlemen, please stay tuned for more coming up on Nile International. I'm Henny Saif. Thank you for